know that's how love goes. It's good for the soul. Oh, I've got a long way to go, but it won't stop the pain. No, that's the kind of thing that keeps me coming back again and again. Till I see your face, I won't be satisfied. No, I won't stop. I won't quit until I'm yours and you are mine. Don't you know? I can't live my life for nobody else but me. Try to help me what to do. I and that's the way that love goes. That's the way it goes. You said it's good for the soul. Everybody should know that's how love goes. It's good for the soul. Everybody should know that's how love goes. It's good for the soul. And everybody should know that's how love goes. It's
All
good
right,
for
we're back. We're back. Listen,
got a long way to go.
we got some things. Don't nobody want us to be great, right? That's okay. We're going to keep talking,
Kind of thing
and it's going to reach who it needs to reach. Huh?
again and again.
Foolishness. All right, y'all. Welcome back. You're tuning in live to the Healthy Soul Talk Show with your girl, your favorite therapist, Dr. Kimberly Thomas. Come on in here. We just had to work out a few things, but we are back. Blog Talk Radio, thank you for listeners. Thank you for hanging on in there. And of course, we know that, all this great technology, sometimes you just got to work through the foolishness, huh? But patience is key. All right. We back. We good. Let's get it. All right. So we were concluding, right? What does it mean to say God has the final say, right? And that is accepting, God's will for our life and
Yeah, I'll
having a relationship. Right?
I'll Reader's Digest it for you, because I know we had some people who probably missed it if they weren't able to. They didn't miss it on purpose. They weren't able to. It's just that we don't. Again, I'll use the quote that I gave you. Don't take a no from somebody who didn't have the power to tell you yes in the first place. God does have the final say. God is He is the one. As it's been said. He's the author and finisher. Mm-hmm. So He created us with a beginning and an end date.
Yeah.
And we're allowed to live our lives, but He is the one who orchestrates. Or puts us in position, I should say.
Right.
Because He's not going to. It's not like the Matrix. It's not one of those situations.
Yeah.
He puts us in position.
Yes.
To glorify and to do His will.
Yes.
And as long as we are in His will, we'll be okay. Yeah.
And not, for me personally, I've just, as we conclude this here, throughout this whole thing, the social unrest, the violence in our community, the hurt, the pain, the devastation, the health crisis, the pandemic, I found that I really have to keep in touch with God and asking, please reveal to me what I need to do next. Right? I don't want to take on the whole world in its issues, because in the beginning of the pandemic, I was just like, okay, something has to give, right? I can't do this like this. And so I encourage you all to really see, even in the midst of all of this, your relationship with God matters so much. And you reaching out to say, God, reveal to me, right, what my role, what my purpose is, even in the midst of this. So I like the clear picture, right? I want a clear understanding.
Yeah.
Right? Of even in the midst of all this evil, all this, every man for himself. And this is across the world, right? I still need God to specifically speak to me. And that's kind of where I've been at, right? That's kind of the space, that I've been in, is really asking God to talk to me, right? So that I'm still walking in my purpose, right? That I'm still, meeting, right, his expectations, of what he's ordained me to do. So I just wanted to encourage somebody with that, right? God's final say, make it personal, right? Not because you can't predict what's going on in the world. And that's kind of, where my conclusion was, I blocked out people speaking to the magnitude of that, right? God has the final say so about this pandemic. That's so broad, right? That's very generic. You know what I'm saying to say? Because then I'm going to say, well, what does that really?
I would suggest to you. We did a show about this. I don't even remember when, about praying for clarity.
Clarity.
I would suggest not to pray for clarity.
Okay.
Yeah.
Okay.
Pray for trust.
Oh, yes.
Yeah, I would suggest.
Come on here.
I would suggest because see, if
Come on.
if I got to show it to you, then why are you gonna trust me?
Oh.
Where's your faith if I have to constantly show it to you?
Wow. Okay.
But can you,
come on.
But can you believe can you believe what's being done?
Yes.
Can you believe me based on my track record? Can you believe me on how I've carried you? So instead of praying for clarity, pray for trust. Yeah.
Oh, I feel like shouting right there. I'm going to hold it together. I'm going to hold it together.
Yeah, don't play for clarity. Pray for trust. Pray for because you want to pray that God give me the ability to trust you even when I can't trace you.
Yeah. Yeah.
So I'm going to pray. I'm going to pray for that God strengthen my trust.
Okay.
Before he opens my eyes.
Yeah.
Yeah. Yeah. Yeah. That's
okay.
it. That's
okay.
it. Now I'm done.
Okay, we go. That's it. Shoot.
Yeah. Yeah. Now I'm done.
Thank you so much.
You're
yes.
welcome.
All right, y'all. Thank you for tuning in. You're tuning in live to the Healthy Soul Talk Show with your girl, your favorite therapist, Dr. Kimberly Thomas. We're back. Let's get to it. All right. So we did our spiritual connect point. You know what's next. What's next is Did You Know? Now listen, I've been holding off on this Did You Know because I know this may be a discussion, but I found it interesting. and so here is the Did You Know? Women suffering from migraines have a higher sex drive. Women, right, suffering from migraines have a higher sex drive. And this is what it says, okay? There was an article published that says migraine headaches and sexual desire may be linked. Okay? It says here, Wake Forest University Baptist Medical Center created this presentation here that says, contrary to popular cliche, not tonight, I have a headache. New research suggests that not all headache sufferers avoid sexual activity. In fact, migraine sufferers reported higher levels of sexual desire than those with other types of headaches, according to researchers from Wake Forest University School of Medicine and colleagues. Males reported levels of sexual desires that were 24% higher than females. Migraine sufferers reported levels of sexual desire that were 20% higher than those suffering from tension headaches. Females with migraines had levels of sexual desire similar to males who had tension headaches. So my question is, should you ask your spouse what kind of headache it is? Because would that change the mood and
can you give us I missed some of the headache. Could you give us the headache descriptions one more time? What's what, please? I'm sorry. Help me out.
Those with migraines,
Uh-huh.
migraine headaches,
Uh-huh.
have higher sex drives than those with tension headaches. And it was just saying that females with migraines had higher levels of sexual desires, right? Than those who had tension headaches.
Okay.
So
the migraine want to get it in. The tension can't do nothing.
Right. But and I guess it is going with that saying when your spouse say, I got a headache tonight. Right? Is that what
That's not necessarily a no.
Huh? Or is that a discussion like,
Well, what kind of headache?
yeah. Huh? Tell you what you think.
Because that is a female question that Dana really can't answer.
But I feel, because, and I'm going somewhere with this, right? In terms of like, we get into talking about what causes friction in relationships.
Mm-hmm.
Right. And of course, this comes up. First, it starts out as a light conversation, but then we like, okay, the frequency of, you're always rejecting your spouse. Right. And the number one reason is because I have a headache. Now, this study says that, okay, if you're that spouse, potentially if you're that spouse who always say, I have serious migraines and that doesn't put me in the mood to be intimate with my spouse, this study say, you lying. Okay.
Okay. All right.
Hey, Malia, welcome. Good evening.
I interesting.
Wait, good. See, y'all done left me out here in the ocean.
That ain't the intent.
Y'all just left me out.
I can't go with it.
Well,
I've never had a headache. I had a headache. I ain't never had a headache stop me from getting.
You know what? Okay.
Sorry. So like, now that that's out there, like, so, I guess if I was a guy, so I'm looking like, so you good. I guess a guy would be like, so you ready. In the words of Dana King, I shouldn't have to pump and prime you. This is the worship though.
Like, where we going?
But man, you are good to know. I'm just quoting the doctor.
Oh, snap. Yo, okay.
Wow.
See?
Wow.
There should be no coaxing at this point. I would just say that. Like,
wow.
If that's not the biggest green light I ever seen, like, what shade were you looking for?
I think that this particular, we want to come with a fun fact, but also, thinking, right? Like, being intimate, right, is a requirement, right, for marriage. So we've been kind of using excuses, right, to get out of it. And I felt like, wow, we didn't went into, and probably we've been studying it, right? But more studies are coming out about these excuses that we've, used to say these physical ailments have decreased sexual, desire. And it's like, no, not really. Is it a tension headache or a migraine? Right? Because if it's a migraine, you're supposed to be ready. Right?
Ready. Right.
Right. So listen, I just, ask your spouse, right? Hey, you want to go to a doctor and see which one it is? Is it a tension headache or a migraine headache?
So now
we need clarity.
That's going to be a woman's built-in excuse. Thank God said when you start talking about this.
I guess you did. No, I'll say this. It could come off as insensitive.
What's insensitive?
Because if I ask, if you really do have a headache.
For the fifth time this week.
No. I'm saying period. that's like saying my stomach hurt. Okay, how bad do your stomach hurt? Because when you say that, it's like because what I want you to know is I want something, and I don't really care about your stomach hurt. Because that's what the person might hear. Okay, your head hurt, but do it hurt that bad? Can we do something? It's like, so now you don't care about my headache. That it could come off that way. I don't know. Maybe I'm just overthinking it.
I mean, you gotta talk to somebody who has a headache. Wow. I'm not going for it. I mean,
I think it's somebody out there, right, saying, what should I do if my spouse continuously have a headache?
take her to the headache clinic.
The headache clinic.
The Mayo Clinic, that's where we going?
No, there's, I told you about the place. There's a headache.
No, I know. No, I know. I'm not disagreeing. I'm just saying. Yeah, I'm not disagreeing. I'm just saying. It's like, what do you how do you get around that?
I think, well, we're going to talk about that in October, right? Domestic Violence Month, that's for sure. Right? Because I know it's some folk who have some full-blown physical altercations when it comes to sex and the lack thereof.
Alrighty then.
You ever ask somebody or a couple, like, hey, you all ever have arguments about sex? You'd be surprised how many couples says yeah.
I don't know. Like couples have full blown arguments. I can see people having if there's a lack, or if you feel like I can see it turning into an argument if there's not some constant communication. But if you leaving people to their own devices, it could get ugly.
Oh yeah. Because I mean, we're physical beings, right? And so clearly, if you live with someone, right, you're physically attracted to them. Yeah. Okay, then I'm gonna leave that right there. So and I think just being in this field, certain questions we ask in general, right, so we can get the full picture. That's a hot topic, right? Like how much is one expected to endure, right, when it comes to not being intimate, in your marriage? Like, how do we not get tense, right? How do tempers not flare, right? When we've been talking about, hormones, right, in our bodies and, physical needs and desires, and that there's a conflict, right? And so somebody needs some understanding. Right. And so now, I think this for me, this whole, did you know, it's just really about opening those lines of communication. If there is an issue, tension versus migraine, like, what do we do about that? Do we leave you as is? And I know you said, what do you do? But it's like, but if it affects other areas of, the relationship, what do we do? Do we leave it there? It's a tough one.
No, you can't not. You only cause more harm when you don't address it.
Right.
Yeah.
And it's the how, right? It's not.
It's the how.
Better.
You can't say, like, for instance, if there's nothing going on, if there's nothing going on, then physically, then you can't come with, hey, we haven't been having relations, and are you getting it from somewhere else? That can't be the opening part of the conversation.
Correct. Yeah.
Right? Yeah. Now, if it's a situation where you're trying to get it and the person is always exhausted, or they can't do this or can't do that, then now it's like, well, what happened? Right? But those are real conversations that need to be had. And the problem is a lot of people don't have those conversations.
Vulnerable. Absolutely.
Yeah.
Very vulnerable. Very vulnerable. Yeah. But it's coming up, y'all. Oh, yes, it is. So think about that, right? You migraine sufferers.
And see, I feel some kind of way about that.
I say it like this.
Because I have headaches for real. So I feel some kind of way about that.
I say it like this. Don't be pulling that falling down the stairs. I'm saying.
Really?
For these headache sufferers. You conscious.
We moving on. We
Right.
are so moving on.
Right. You said your head hurt. The one that I'm trying to get ain't right.
Oh my God.
See, I'm just trying to see. That's the insensitivity part.
Yippity skippity.
Don't get these skippity paps.
Lord help us. Lord
Anyway.
help us. All right, y'all. That's that. Did you know?
Did you? Did you know? We know now.
Let's talk about it. Shoots. All right, here we go. Topic for this evening. You know, we kicked off this month with talking about psychotropic medications. Last week we talked about antipsychotic medications and dealing with hallucinations and delusions. This week I wanted to dive into talking about antidepressants and anti-anxiety medications. All right. Now keep in mind, you all, you know, this is just for discussion, right? Definitely, as we talk about these things, I hope that it should motivate you to go talk to your doctor, right? And follow the appropriate steps to getting the care that you need. And if you are taking psychotropic meds, antidepressants, or anti-anxiety meds, I hope that this sparks any questions that you've had, that you also check in with your doctor, right? Your psychiatric team. That's so important. Even when you're taking these meds, to update your doctors and never keep it to yourself. I'm an advocate for it. You know, if you are prescribed a regimen, right? Don't leave your doctors in the dark about what you go through. And because then that leads to other things, right? You trying to cope a different way. So I do hope that this discussion this evening provokes you, right? To really get the answers you need with the appropriate level of care in the team that's needed. All right, here we go. So talking about kicking it off with antidepressants, right? We know that antidepressants medications are used to treat depression. Now, one of the things I wanted to point out is that your primary care doctor, right, can prescribe an antidepressant without you being diagnosed with major depressive disorder, you know, or any type of, mood disorder, post-traumatic stress, right, anxiety, social anxiety, all of these diagnoses of mental illness, these conditions, we say that there's some level of depression that a person experiences. And so with that, we know that there are people being prescribed without having, right, a diagnosis. Wanted to clear that up. So there is that such thing. And what I encourage people to do is, you know, if you have those feelings of depression, I know that primary care doctors can prescribe it, but I encourage you to go into psychiatry because there's another level of care. Once we get to talking about these medications and finding the right medication, as well as doing the blood work that's needed to make sure, you know, other organ systems of the body are not being impacted, that really comes with, right, that next level of care. So I really want people to understand, you know, follow up, right? Follow up with the regimen, either if your primary care, if there's this area of specialty, or ask for that referral to psychiatric care. Now, let me just say there's a stigma with psychiatric care. You say the word psychiatric or psychiatry, people just like, I'm not crazy. You know, I ain't that bad. But it's like, that is the level of care that manages, right? You know, our mental stability, right? And so understanding that, let's dismantle this stigma associated with, yes, you should do a follow-up with a psychiatrist. They are the medical doctors for our mental health, right, profession. You know, they have to do certain things to ensure that your levels, the medication is appropriate. They're the ones, right, who have that level of expertise with those questions that you have about how this medication is impacting your body. All right. So let's not put this dark cloud over the term psychiatrist and psychiatric care. Right. Just like you go, you all chime in here. What's that? Cardiologist, right? Neurologist, right? We know that they're kidney specialists. Every organ has a specialist, right? Your mental capacity, your mental stability, your brain has a specialist, right? And so understanding, I just want to normalize, right? Normalize the level of care of psychiatry. Okay, that's first and foremost, all right? So that's that, right? But antidepressants, right? I just want to zone in on what we call SSRIs, right? Serotonin reuptake, right? I'm gonna get that right one day. SSRIs, that's the classification, right, of drugs that are prescribed for antidepressants. And so when you think about this, we're going to get into what these medications do, how long it takes, right, and how they help the balance, the chemical balance in your brain. Okay, antidepressant medications can lead to improved moods, concentration, and sleep, but it takes a few weeks, right? And often certain types of symptoms or relief from those symptoms can take hours, okay, for these medications to fully work. And so I think that, especially when primary care doctors are prescribing meds, they don't necessarily explain when a person should feel relief. So a lot of times we look at psychotropic meds like Tylenol, right? Like, okay, I should feel some relief, right? And within the next 30 minutes, right? And it doesn't work like that. There is a system, there is a rhythm that your body has to, adjust to for these medications to become consistent and align it, right, with your body and the chemicals in your brain so that it works effectively. And this also includes finding the right dosage. All right. And so we know that the most widely used or prescribed antidepressants is Prozac, Zoloft, Paxil, and Lexapro, right? And Celexa. Okay. And again, they have different dose levels. Now, I will say that depending on, especially if you go to your primary care doctor, they listen for the symptoms. I know when you all go to the doctor, they give you this screening, right? Like a depression screening. They go off those screenings and what you tell them, especially as it relates to if you are going through some things at work, depending on how severe you report your symptoms, that very well depends on their level of dosage, right? So they may do the low end or they may start you out at the high end, depending on how you report your symptoms. This is where that follow-up is critical, because if the dosage is too low, you're not going to feel, right, any relief. And many people give up, right, at that point. And now, obviously their condition or the symptoms worsen. And then those who the symptoms is too high, the dosage is too high, they feel like zombies, right? Or they feel like, okay, I'm just not really enjoying life. I feel a little bit better, right? But I still feel like blah, okay? And so some of the side effects from these antidepressants are nausea and vomiting, weight gain, diarrhea, sexual problems, fatigue, agitation, drowsiness, right? Insomnia, nervousness, headaches, dry mouth, and increased sweating.
So I got a question.
Mm-hmm.
Why does it take so long? Like, why does it take so long for the medicine to start working? And then, but the moment or a day or two of not taking it, you can fall off so dramatically.
So we know that with psychotropic meds, because it's changing the chemicals, the chemical balance, right? It's trying to align you. That takes time. You know how when you take a pain med, it goes straight to the pain, those neurons and neurotransmitters, right? It goes to the pain, right? It goes right there.
Right.
With psychotropic meds, it's actually working on the balance, the chemical balance of your body.
Okay. So I know you don't do medication.
Yeah.
But just your thoughts,
Mm-hmm.
because I've seen doctors. Well, not me.
Okay,
Just
no,
let me
got
say. Working at thresholds and
Yeah,
heart
yeah.
growth
Mm-hmm.
and everything. Working at thresholds and heart growth, like, you know, I've seen them, you know, give members the same medication in pill form, but also would give them an injection.
Yes.
Well, some members would get the injection instead of the pill form. Do you think one works better than the other?
Wait, now that depends on what they're injecting them with.
Sometimes, like, you know, sometimes for we had one
Because if they, you know, for the psychosis,
like ADHD, like one.
if they're
is ADHD almost considered psychosis, or where would you?
No, we
Okay.
no. I think so. In that capacity, there are medications, drugs, right, to muscle relaxers, right. We're talking about calming, right, certain parts of the body, right, to mobilize them. You know what I'm saying? So it's not necessarily because they're asleep, right, like they're out of there, right. So there are certain drugs that actually, for all practical purposes, tranquilizes.
Yeah, and I mean, like, I say this because I know they, you know, for a family member of mine, like, you know, it took so long for it to build up, but as soon as he is off of it, it's like, you know, it's like they scrambling.
Yeah.
Well, it's like your fault. You should have been had the medications on deck.
That's a great debate, right? In terms of a person. Now we're dealing with, you know, moderate to severe mental illness. So we talked about the hallucinations, the delusions. So those drugs, those classification of drugs for antipsychotic, those drugs typically stabilize, right? And a person will need to continue those meds, right, for their duration, because it regulates, right, the functioning of their brain. When it comes to antidepressants and anti-anxiety, we have to be very careful, especially with anti-anxiety meds. Your body actually gets used to it, right, and then it no longer, right, works. So anti-anxiety meds are short term. They're supposed to be short term, and so we hear a lot of people with, you know, especially when they say, I've been on this for like 3 years, 4 years, and it's getting worse. And we have to take a look at that, because anti-anxiety meds weren't meant to be a long-term regimen, right? Remember, it's finding chemical balance. It's not a neurological defect, right, when it comes to anti-anxiety meds and antidepressants, unless we found that there's something, you know, dysfunction or deficient, right, in the brain itself. But that's usually found early on, right, in life. So you're absolutely right when you say it does take a while. It takes a couple of months, actually, to get regulated.
I've heard, you know, and for some people, by the time they're trying to put people on the medication, you have to wait another 4 to 6 weeks. I mean, I heard 4 to 6 weeks. Now you said months. Like, wow.
4 to 6, 4 to 8. You know, there's still, you know, a couple of months, right?
It's a month. It's a month.
And that's you know, taking it regularly, right? That's actually, you know, making sure you take it, you know, at the same time every day. That's, you know, giving the feedback to your, you know, psychiatrist, right? Your primary care that so those side effects that we talked about, sometimes, you know, I've had clients where the side effects were so intense that, like, they cut the pill in half, right? And so now they've changed, right, the regimen. So it's like, that's not good, because we don't know, you know, what your true dosage should be, because, you know, those side effects, right, were too intense. So it's so critical when you say, let's track how long it takes for you to feel relief at minimum, right? We usually give 8 weeks, about 8 weeks. So that's 2 months to come back. And if you really, you know, into, you know, what we're doing now, it's like people are being prescribed 3 months, 90-day medication regimens. And that is to say, okay, we need to do this for this specified amount of time so we can see how your body truly adjusted. Did you eat right? Right? Are you drinking your water? Sometimes we have to think about talk therapy along with this medication regimen, because it may not be your body not producing, right, the serotonin or the necessary chemicals to regulate you. It may be something you're stressing out about. It may be something internal or external, right, that's causing you to feel this mood disturbance. Yeah. Because, sometimes people say, well, I'm still depressed, and they're on the medication. And now, we ask a million questions about what's going on in your life. And it's like some of your external things didn't change, right? So you're taking the medication, but you're still unhappy with your job, right? You dread getting up in the morning. Just the thought about going to this job, right, makes you depressed. Really, there is no medication that's going to make you happy. Right? So I like to, explore that with people to say, okay, can we find whether there's internal or external, right, primary causes to why your mood is shifting into the depression, or even with anxiety attacks, right? Because that's excessive worry, and what are you excessively worrying about? Okay. All right. So it says here, so yes. So we got into the medication taking a while, right, to work. And that's vitally important to understand that no, psychotropic meds are not like the medications we take for, heartburn, right, diabetes, that insulin shot, it doesn't work like that, right? We need time for your body to adjust and get the right dosage. Okay. The side effects should be temporary. Right, some are temporary, but some, unfortunately, they're like the duration. Right, throughout the duration, as long as you take that medication, and that's why you hear a lot of people, or a very significant amount of people saying that they were prescribed another medication to deal with the side effect of that antidepressant. So if the more long-term, like sexual problems, right? That's one of the long-term, right, effects of antidepressants. Then the doctor may prescribe something else, right, to make sure that's intact. But the insomnia, the dizziness, the nausea, we need that. That's more of the short-term, right, the temporary effects. That's why I say more people need to communicate with their doctors for those other symptoms: fatigue, right, weight gain, diarrhea, drowsiness, agitation. These are our initial side effects that should subside, right? But it's important that you let your doctor know about these, because they need to explore how to get those side effects minimized, right, or eliminated while you take this particular SSRI. Got it? All right. Different medications suit different people. And again, this is where being open with your doctor, if there is a collaboration, we're going to get into some questions at the end when talking about whether or not you should take an antidepressant, right? Understand that you may be asked to take a different medication if those symptoms don't subside. Our bodies are different. So what worked for one person, that particular medication may not work for you, right? So you may work better with sertraline, which is Zoloft, right? Or the next person may do well with Prozac. Okay, so really understanding, I know we talk a lot among each other. We see a lot of commercials. We look at Google, right? We still need to take in consideration how the specific medication will impact your body, personally. All right. Understanding too, it's important that you give yourself time to recover. What does that initially mean? Even when you start to feel better, right? There is a such thing as weaning off, right? We know that, as you just said, Tanya, like, okay, sometimes, well, most times when you abruptly stop your medication because you start to feel better, those symptoms come back more intense, right? So really thinking about your body has just got aligned. It got balanced because there was this chemical, there was this, assistance that you had in your body that helped you, right, maintain its emotional stability. So to abruptly stop, that can be dangerous, right? That can be dangerous not just for your physical state of being, but also for your emotional and mental state as well. And so we usually give about 6 to 12 months, right, to assess whether or not you should stop the medication. So rarely will you get a doctor who say, you shouldn't get a doctor that says take these antidepressants for 30 days and then we'll think about whether or not you should continue, right? Minimum they're going to give you is usually between 6 to 12 months. All right, what y'all think about that?
Okay. It's just so many facets to medication and everything. So it's just like a lot to take in because, like you said, the side effects, like, is that where the what's that called, tardive dyskinesia?
From the antipsychotic.
Yeah. So
yeah,
like because now I think, isn't it spreading into the antidepressants as well? Because those side effects were just for people with psychosis, and now it's like it's coming into.
So I think what I want to put into that is the entire regimen, right? Because there are some individuals who are prescribed antipsychotic, antidepressants, and anti-anxiety meds simultaneously, right? So I feel like I like to say it's a cocktail, right? That I can't really say, TD is what, which one it stems from. And that's kind of the challenge, right? Is really, which drug, under which circumstance, and what else is going on, right, in the person's body, right? But definitely for sure with the antipsychotic meds, we do see that particular side effect. Absolutely. So the next thing, we get into is knowing how these medications interact, right? And so, you have to understand when you're taking multiple medications, please do your due diligence to see what happens when all of these drugs are in your body, right? When you think about combining antidepressants with other medicines or illegal drugs, this increases, right, the serotonin, and it can cause a serious reaction, right? It can actually become a toxic, right, chemical in the body, serotonin toxicity. All right. And with that being said, I think about, and this is just, where I am with it. When you consume marijuana, alcohol, antidepressant, anti-anxiety meds, that really is a dangerous combination, right? And there are some who don't, like, for instance, right, if a person decides they're going to go out and have a good time, some will not take their meds, their psychotropic meds that particular day, right? But some will. And understanding that your body is still mixing, right, all of those drugs together. So you have the ethanol, right, which is in the alcohol, and you have the THC, which is in the marijuana, okay, and then you have the serotonin, the SSRI, right, inhibitors in your body. And so you really have to understand that there are some symptoms that can really be intensified when you mix all of these drugs together, even with pain meds. Okay, really, I always tell people, if you're going to put substances in your body, do your due diligence to at least get, right, what generally happens when a person takes all of these substances at the same time. Right? Because you don't know, right? And so we have to be very, very careful with that. And so when we think about that, one of the other things to look out for, when we talk about when you're prescribed an antidepressant, a lot of times we say try therapy along with it, right? Because when we think about mild depression, even mild to low moderate depression, we find that there may be some form of talk therapy, whether that's individual, family counseling, group counseling, that a person needs to really work through the root cause of the change in the mood, the sadness, the lack of drive, the lack of motivation, right, that they have. And so there are certain modes of therapy that actually can, all modes of therapy can help one get to the root. But when we talk about short-term or brief therapy, cognitive behavior therapy is the go-to choice for helping one figure out the root cause of their depression symptom as they're being regulated with the medication. Now, when it comes to severe depression, right, this is the one where you're depleted. This is the one where you stop doing your bathing, your hygiene. You're not getting out of bed, right? You're not eating, so you have excessive, right, drastic, significant weight loss. Some other organs in your body may be changing. You may be dehydrated. So then this is where we say, okay, more of the medication is needed to help stabilize you, and then, right, incorporate another type of intervention. But sometimes, especially with severe depression, we know that should automatically be treated with an antidepressant. One of the other main side effects of a major issue with antidepressant medication is its suicide risk. And so we know here, because obviously there are many studies that go on where antidepressants can make depression worse rather than better for some people, leading to an increased risk of suicide, hostility, and even homicidal behavior. Right? This is, we more so see it with children and young adults, but really anyone taking antidepressants should be closely watched. All right? It also says here, monitoring is especially important if this is the person's first time on depression medication, or if the dose has been recently changed. All right? And so I want us to think about this, because this is where you have to care for your loved ones, right? I think for me, I hear a lot of, right, you need to go get some medication for that. Right? You need to go get some medication for that. But what we don't do is, okay, you may have the medication, but is it making it worse, or is it helping you? Right? And instead of saying, are you taking your meds? Right? We begin to accuse the person of not taking the meds because it looks like they're getting worse. And they're like, yes, I am. Right? Well, it ain't working.
I get asked about meds all the time.
What do you get asked about meds for?
I don't know. Ask her.
Okay. Okay. Are you hostile?
I just get asked all the time, do you take your medicine?
Anyway,
I ain't even got no medicine.
You're not complying with your medication?
I don't have any.
Oh. That means you didn't need it.
That's what I'm trying to tell you.
Okay, so she thought you did.
Y'all are funny. So listen. Y'all are funny. Signs that the medication is making things worse, right? Includes increased anxiety, right? Panic attacks, insomnia, hostility, restlessness, and extreme agitation. Got it? Mm-hmm. Extreme agitation. Particularly if the symptoms appear suddenly or rapidly deteriorates. Okay? If you spot the warning signs in yourself or a loved one, contact a doctor or a therapist immediately. Okay? Listen to loved ones. It's not about, okay, if they're still depressed and they're saying, I don't know why I'm still here. This life is hard. Don't just say, keep taking your meds. Right? Because they are taking their meds. And if that medication is not working for them, and you're listening and you're continuously hearing and you're seeing, right, them change for the worse, right, we need to get them some help. Okay? So understanding, be aware and be knowledgeable about the medication itself. It's not that, you're not doing it right. we have to find what works for you. And so we put these studies out here. We put this information out so you can be aware of how these medications impact your body. All right. And especially when it comes to a friend or a family member contemplating suicide, right? Every statement, every gesture needs to be taken serious. Because it says here the suicide risk is greatest during the first 2 months of antidepressant treatment. And this kind of goes into that concept where you say, I know they started their meds, they looked like they were doing okay, right? And either we have an attempt or we have an actual completion of suicide. All right. So we don't want to leave that person alone. We don't want to just say, okay, they're good now. You got your medication. Okay, great. That's it. Right. We still want to check in to ask how they're doing and if they're okay. And even encourage that person to talk to their doctor if they're feeling some type of way. And if you don't have anyone checking in on you, I encourage you to talk to your doctors yourself. Right. Be an advocate for yourself if you feel these increased symptoms. All right. So those are the antidepressants, right? That medication that's used, right, to treat the symptoms of depression, right? It treats the symptoms of depression. Mind you, we still need to figure out how you can eliminate those intense symptoms, right? Remember, we're dealing with a clinical diagnosis. I like to think that you've been clinically diagnosed with a mental health condition in order to be prescribed the medication. Now, I may get some pushback for this, but so be it. All right. Be careful with requesting antidepressants for external stressors going on in your life.
So you don't have an imbalance. You have not a chemical imbalance. You got a physical, external imbalance.
Right.
But you won't take a pill.
Yes, to deal with those people. Right? To deal with those people. Not to deal with how your body, right, is changing. Right. And how, like I said, those serotonin levels. Because here's the thing. We found that, especially in the pandemic, vitamin D levels. Many, many people had, and I was one, that had a vitamin D deficiency. Right. And they did the blood work. And I promise you, I was so tired. Right. My bones were even aching. Right. When I would get up in the morning. And so they were like, we need you to go on this regimen. Like it was the highest dose of vitamin D. Right. And I felt, right, physically, I felt a difference with the vitamin D. Then I did feel more, less irritated and kind of more stable emotionally because I was busy. Right. And so sitting in the house all day, I was not going outside getting fresh air. Right. Everything was cut off. From the sunlight to, just kind of what I was used to doing. So I say that to say, right, make sure that there's nothing external that's driving your feelings of depression. Not you haven't been clinically diagnosed. I'm very careful, right, when I'm talking to people and they're like, do you think I should get on medication? And I haven't even done an assessment. Right? You're sharing with me, and this is just not clients. These are just, people who are, just talking to me and they're like, I just feel so tired or, lately, I just been sad. I got all this stuff going on in my life. Right? You think I should go to the doctor to get some medication? And in my mind, I'm like, we take medications for diagnosed conditions. Right? And so I encourage you to deal with your stressors first, right? Look at how you're treating your body. We've been talking a lot for the last few months about taking care of your body. Sometimes it's just getting back to your old routine or getting a new routine to alleviate these symptoms of depression. Right? Because when you get into medication, in essence, that's saying that my condition is debilitating. Okay? Debilitating is the key word when you say this is why I need a regimen for antidepressants antidepressants or anti-anxiety meds because I'm debilitating, right? I'm debilitated. I can't go to work. Matter of fact, I don't go to work. I can't regulate my emotions no matter where I am. It can't just be selective with people. Well, when I'm in my relationship, I'm a mess, right? But when you out with the crew, you okay. You know, so we just want to be careful with under the circumstances that we automatically say, I need medication for this versus looking at our lifestyle and assessing, is it more internally my body and how it's physiologically, right, functioning, or is it something external which I need to work on, all right? So that's that, right? So we kind of, you know, if you may be saying, well, I was prescribed some of those medications that you listed for anxiety. Right, so we know that yes, there's some SSRI antidepressants that are used for anxiety as well. So sometimes I do hear, I'm like, okay, so what is the doctor prescribing this for? Is it for anxiety or depression? Because sometimes it's two meds, right? And it's like, okay, so they're loading you up here, right, with these medications to stabilize you. You need to understand which one is for which. So yes, there is a such thing as an SSRI antidepressant being prescribed for symptoms of anxiety. And so kind of going back with the abruptly stopping these medications, I want to just point out here some things that kind of creep in that we don't associate with SSRI withdrawal. This can not only trigger symptoms of extreme depression and fatigue, but it also can trigger extreme anxiety, flu-like symptoms. All right, anxiety and flu-like symptoms, as well as irritability and insomnia. Okay, so I just wanted to put that out there, like, you know, thinking about how one can withdraw from, you know, narcotics or illegal substances. There is a such thing as withdrawal, right? Symptoms from SSRIs, those antidepressants. Okay, so we know that anti-anxiety meds are used to prevent anxiety and treat anxiety. Okay, related to several types of anxiety disorder. Now, here's where I want to zone in on anti-anxiety meds. These drugs tend to work quickly and can be habit forming. Because of this, they're usually only prescribed for short-term use. Okay, the most known classification is benzodiazepines. Right, benzodiazepines medications, and so this is a heavy. How can I say this? These are street drugs, right? That are sold as well because of actually one can feel drunk, right, or a really intoxicated feeling, right, off of drugs, especially when it gets saturated into your bloodstream. Now, these particular meds, because they're quick acting. And I don't know if you all have ever heard someone who says, you know, I need to go take my nerve pills, right, before I go into this meeting.
That's been the black folks saying since 1890.
Let me get my medicine.
You got my pressure up.
Let me go to the car and get my medicine before.
Right.
Anti-anxiety meds, right, can take effect within 30 to 60 minutes. Okay, and so they can lower symptoms of anxiety in a short period of time and prevent panic attacks. Okay, and so really getting into, you know, obviously we need to get to the root cause of anxiety and panic attacks and the severe symptoms of anxiety, because obviously one, you know, we need to see why your body is responding in that way to where you need medical intervention, okay? And so when you think about anti-anxiety meds, again, everyone reacts differently to these medications, all right? Each person metabolizes medication differently, okay? Because it can react with certain foods and drinks, all right? For some, anxiety medications work well. For others, symptoms are reduced but remain. Others still may find that anxiety medications actually make them more anxious It's a matter of trial and error to find the right medication and dosage for you. Okay, and so when you think about that, right, and what are the side effects, right, of benzodiazepines, which we look at these medications such as Xanax, right, clonopine, these are the commonly prescribed, and it's kind of similar when you talk about the side effects of this: drowsiness, dizziness, poor balance, coordination, slurred speech, right? Trouble concentrating, memory problems, confusion, upset stomach, headache, blurred vision. Okay, so when you think about that, right, these are the symptoms that come with that, but also we know that people, they get a certain, I don't want to say high, but there's a certain thing, euphoria, that comes with taking these meds. And Xanax is the most common street drug, right?
Really?
Yeah. And I'm talking 6, 7, 8 at a time. People have overdosed, and unfortunately, it's been fatal, right? With Xanax. Wow, this is how addictive, right? These medications can be, and they're very popular, right? They're very popular on the street. The benzodiazepines. These, this is one of the drugs when we do our quick drops. That has to be on the panel of drugs that we test for, right? Because it's the most commonly abused drug as well. All right. So with that being said, right, back to the medication, right, it's good for short-term solution for anxiety, okay? And so, again, pairing it up with CBT, cognitive behavior therapy, it has been found to work better for long-term help from anxiety. So I really encourage people, right? I understand, like, sometimes you need to be balanced. You need to have some symptoms that are eliminated or minimized so you can sit, right, and talk about the issues that you're having or experiencing in your body, just in your world, right? And just really going there and saying, hey, I'm ready to talk about that stuff that I've built up. I'm ready to, really process how I got to this place. And sometimes it's trauma, right? We do a lot of trauma work, and, a lot of people are unhappy with some of the things that are going on in their world, and it's causing excessive worry, sleepless nights, you're not eating. And all of this kind of plays a factor, right? If you're stressed out, your body is not physically okay, right? You are not getting the nutrients you need. You're not sleeping, so now you are tired because your body is not getting the proper rest. Yes, it flares up, right? Your body flares up. So I know that there are times where your body needs to be physically addressed in order for you to sit, talk, and take the appropriate, treatment goals to address the root cause of why this anxiety keeps flaring. We all experience anxiety, would you say? Like,
absolutely.
It's that I can't say you won't ever, right, have feelings of anxiety. It's how you manage it. Right? It's how you manage it. And again, taking medication, especially anti-anxiety meds, without having a proper diagnosis does not give you the blueprint that you need to address the issue. Right? So if you have generalized anxiety disorder, if you have, social anxiety, if you have phobias, right? I remember that month we talked about phobias, right? Mm-hmm. That's a serious thing. So you need to know, what condition am I working with that is causing these extreme feelings of anxiety? You have to know what's going on. So I know we don't like to label, we don't like to stigmatize, but I look at diagnosis as a blueprint, right? Because with the diagnosis comes a criteria. You met the criteria, right, for this specific condition. Therein lies, okay, what is the appropriate treatment plan? So I encourage you, right, go beyond your primary care prescribing the meds to say, I need to understand what's going on with me. If I have a condition, just like, a heart disease, high blood pressure, right? Every organ, right, has the potential to acquire a condition. Okay, so take your mental health just as that, right? There are certain conditions that you can have, even in the mental capacity, that you need to know the blueprint for, so you can know how to appropriately treat yourself both short and long term. Okay, don't take that for granted, not knowing what condition, right? What condition is supporting or perpetuating these intense, debilitating symptoms of anxiety. Okay, let's keep going here. Anti-anxiety medications may limit your other activities. All right, you can catch a DUI for driving, right, under the influence of benzodiazepines. Why? Because they clearly say may cause drowsiness, do not operate heavy machinery. Seen it? Help people, right, get the license back, right, to say, okay, what happened, right? When they tested you, they didn't smell alcohol, they didn't smell the weed, but they looking at you like something is off. You're drowsy, you got lack of energy, you acting confused, impaired thinking, your judgment is off, right? You got blurred vision because you don't see how many fingers I'm putting up, right, in this what they call that the roadside test, right? The field sobriety test, you failed all of them, right? And that is because, right, you were not supposed to be operating heavy machinery, right, with some of these psychotropic medications, okay? You may have problems at work, even when it comes if you're in school, because you may feel sleepy or groggy, all right? So again, understanding what am I getting into, right? If I decide to incorporate a regimen, right, to address my anxiety, okay? Anxiety medications may build up in your system. Anxiety meds metabolizes slowly. So if you're taking benzodiazepines on a daily basis, the amount of medication in your system can build up. You run the risk of being over-medicated. If this happens, you may feel as if you're drunk, and others may think you're drunk. Got it?
What you trying? You laughing a little hard. Why you laughing like that?
I was looking at you.
Yeah, but why you laughing? Talking about others may think you're drunk and you start snickling and carrying on. Everybody real tickled in here, huh?
I didn't say nothing.
You probably tickled underneath. You stay tickled.
What? Okay, I'm just gonna keep talking. Mind my business.
Medication because he thinks I'm tickled.
You what?
He thinks I'm laughing at him.
Oh,
he need an antipsychotic medication.
We back on.
He'll be all right.
Oh my goodness. Anti-anxiety meds can worsen symptoms, right? In a few cases that we have studied. Okay. And so it has this opposite effect, making them more nervous or anxious. Okay. They may become more irritable. And some patients, like with antidepressants, become aggressive and hostile. Some may even hallucinate or experience periods of mania, right? And we know that is where they are just kind of up in this grandiose, heightened sense of being, right, for a prolonged period of time. Okay. So looking at that, right, listening to that, we know that with anti-anxiety meds should not be taken if you're pregnant. And that is because anti-anxiety meds can cross the placenta and reach the growing fetus. The baby can become dependent on these drugs and experience withdrawal symptoms after birth. All right. Because of this risk, anti-anxiety medication should be avoided when pregnant. Okay. The risk of addiction to benzos, as they call them, this is why it's really advised to do a short-term solution to this because of its risk of addiction properties. And so, as I say, this is one of the most abused and for all practical purposes, addictive drugs on the street. All right. And so you will need to be weaned off this particular medication when you are under the appropriate supervision of your doctor to watch those withdrawal symptoms. You know, I think about this, and many people mistake symptoms for symptoms of the condition for the withdrawal, right? And then they don't want to go through the withdrawal. So hence they take more than they should. Mm-hmm. This is why it's so important to be under doctor's care when you're taking this particular medication, to understand what you're actually working with, right? Is it that I'm feeling this condition come back, or is this my body now adjusting to, right, the reduced or the elimination of the drug itself? All right. And so you want to be understanding of, because guess what? It's temporary, right? Withdrawal symptoms is temporary, but it can also consume you, and it can also make you feel as though you're back in that initial state of being that you were in. Okay. Understanding that anti-anxiety meds lose their therapeutic value over time because your body gets used to that specific dosage. That's why we really say, you know, make sure you understand the level of care that's appropriate for you to get to the root cause of this condition, right? Because once your body gets used to that dosage, you've been on it for a prolonged period of time, and I've heard this. We back at the doctor and they just increase the dose, right? We just can't keep going up. Because at the end of the day, it's just your body getting used to this particular dosage level, and now it's like, okay, I don't feel it. I don't feel the way I used to feel, mm-hmm. right? But I'm also not addressing the condition either, right? I'm just addressing my physical symptoms of anxiety. Therefore, we just go up and up. Now we're changing meds, and it just breaks my heart when I hear people, you know, they've been on anti-anxiety meds for like 5, 6, 7 years, and they're just cycling through the medications, right? Wow. Going up and down on the meds, because really they've not taken the time to say, what is my condition? And what other ways am I addressing my condition? Right? Has to be where, okay, am I trying to get rid of, right, this condition? Not never feeling anxiety again, but no, getting rid of the condition. How am I addressing the condition, right, that's intensifying these symptoms? And that's where it breaks my heart when I have people and I ask the question, how long you been on these meds? And it surpasses, right, 3 years. I've been on this since I was 16, and I'm 34 now.
There should be an end point.
Absolutely. Unless you've gone to a neurologist, right? Mm-hmm. Unless you've gone to, unless you've gone to specialists to say your body can't produce the necessary chemicals, right, to regulate you as a standalone, right? No, it's short term, right? Because now your body is getting immune to this drug, and now you need it to function. Does that make sense? So it's like, when I got my teenagers, right, being prescribed meds, many pediatricians are like, I don't like this, right? I applaud those who say, I ain't down with this, but, mom saying this, school saying that, right? We're going to talk about those childhood disorders in September, but really looking at that kid could be on psychotropic meds from age 16 endlessly, because we've told them they need, quote unquote, medication to be regulated, to be stabilized. When it's like, so when are we going to address the condition and determine whether it's external factors, right, or physiological or biological chemical imbalance? Who's going to look into that, right? Who's going to do the legwork to say, hey, you have, this condition, right, where your body, right, not because your teacher said or your family says, or you always, losing your anger. Sometimes external factors are the driving force behind somebody starting psychotropic meds at the age of 16 and now they 27, right? Now they 34 thinking that, oh, this is the only way I could be cool is if I'm on medication. Right? And it's like, wow. And guess what? They still have issues. Right? You know, they still have relationship issues. They still have challenges maintaining employment because they get frustrated easy. You know, I'm hearing all these things and it's like, but where was the level of care right back then that was supposed to guide you into, okay, this is life. Right. This is what life consists of. How do you see some other ways you can manage, right, through these life obstacles, right? So I feel like, you know, what warrants is just please make sure, right, that you get every level of care that's accessible to you to address these conditions, okay? All right, so we know that benzos, right, benzodiazepines, right, there's a safety concern because there's a dependency and then there's a withdrawal, right, that can take place when you abruptly stop and or there's this prolonged continued use of it. Benzodiazepines can also worsen cases of pre-existing depression. Okay, and more recent studies suggest that they may potentially lead to treatment-resistant depression. Okay, and this is where I see the cocktail. This is where I see the, okay, don't take this, take that. Right? But you know, you have to advocate for yourself. I push. Even if you just go for 2 to 3 sessions, right, to see a therapist, you need to understand, right, what's consuming you cognitively, what's consuming you mentally, what's consuming you emotionally, because then nobody teaches you how to deal with your emotions. Like, I'm pretty sure all of us were taught, like, okay, you know, when you're out, if somebody makes you angry, right, you know, try this, right, or do that. I know you advise the kids a lot, right, when, the same way with adults, right, it shouldn't just stop while you're in school. Learn how to behave. No, while you're an adult, right? Learn how to control your emotion, but that comes with making sure you have the appropriate, you know, person that you can talk that out with. Okay. When you abruptly stop taking benzos, some of the severe withdrawal symptoms you can experience is restlessness and shaking. All right. Stomach pain, panic attacks, confusion, pounding heart, sweating, and in severe cases, seizures.
Wow.
All right. And as I stated, many people mistake withdrawal symptoms for a return of their original condition, making them think that they need to restart the medication. Right? So what you thinking about?
I don't know. I think it's I don't know. It's kind of a double-edged sword because you got people who they know they need the medication, but they're taking it reluctantly, or they purposely don't take it the right way.
Yeah.
Or no, I'll say this: they won't take it and try to mentally make themselves better when they don't have the chemicals to do so.
Right.
And then they will unfortunately not be honest. I mean, the one place you have to be honest is with your doctor and telling the doctor that it's not working, but you're not really taking it. Mm-hmm. You know, only to end up getting a stronger dose.
Yes.
That's a problem.
Yes.
Yeah.
And that's why I think these collaborative services are, let me just say, I know many physicians, primary care doctors who are advocating, right? Talking to, you know, those specialists, right? Advocating. But I also know that because some have had their same primary care doctor for years, right? It may just be this rhythm, right? This relationship that they have, right? That we're just going to continue, right? Your medication regimen, because we've just been doing it all this time, but not really. Okay, let's dive into why this hasn't subsided for you. Right? Why hasn't this symptom, or of course they can't give a condition, right? Because there's a pretty lengthy evaluation, right, that goes into figuring out that condition, Yeah, so that navigation of it is, let's just kind of filter through, right? Filter through that, okay? And so I want to kind of, kind of give this last bit here with the anti-anxiety meds, kind of like the connection between benzos and accidents, right? And so I push that because there are many people that are being prescribed anti-anxiety meds, and they really need to understand the danger, right, that they can put themselves in when they mix the drugs, right? We know that especially with anti-anxiety meds, you cannot drink, right? Because benzos mixed with alcohol can lead to fatal overdose. Right? And this is where you hear that compromise, right? As that person saying, well, I know I want to have a good time tonight, so I'm not going to take my meds. Right? So what if you have a few good nights, right, of having a good time, and you don't take those anti-anxiety meds like you should? We're going to have some issues, right? Because you can't take your anxiety meds while you're drinking, right? So we have an issue, right? You feeling those withdrawal symptoms, in addition to, right, that mood change that you have with the alcohol that you're consuming, okay? But the combination of alcohol and benzos can be fatal, right? Don't mix painkillers or sleeping pills with benzos. Okay? Taking benzos with prescribed pain and sleeping pills can also lead to fatal overdose.
Taking what with sleeping pills?
Prescribed pain meds.
With sleeping pills.
Or sleeping pills.
That's a bit
with
much.
Benzos.
Okay.
Can lead to a fatal overdose. All right? Antihistamines, found in many over-the-counter sleep, cold, and allergy meds, are sedating on their own. Be cautious when mixing with benzos to avoid over-sedation. You trans
90 seconds.
You out of there, okay? So really, right, being cautious with that, right? There is a such thing as you can your body can go in toxicity, all right? With these combination of drugs, all right? So I want to close out with this, right? Questions to ask yourself or a mental health professional as it relates to should you get a psychotropic medication
60
regimen,
seconds.
right? Is medication the best option for your condition or problem? Are you willing to put up with unpleasant side effects, right, in return for relief of anxiety or depression? What non-drug treatments might help these symptoms? Do you have the time and are you willing to pursue non-drug treatment, such as cognitive behavior therapy or some other form, right, of therapeutic approach? What are the self-help strategies that might help you get your anxiety or depression under control? And if you decide to take anti-anxiety medications or antidepressants, should you pursue other
10 seconds
as well? All right. Questions to ask your doctor. How would a medication help your anxiety or depression? What are the drug's common side effects? Are there any food and or drinks I would need to avoid? How will this drug interact with other prescriptions? How long will I have to take this medication? And will withdrawing from the medication be difficult? It's almost like you need to interview this drug, right?
Yeah, you have to do your research.
You know, you need to ask those questions and be clear, right? If I have all these other medical conditions, I'm taking all these other medications. Is it safe for me to take these antidepressants or these anxiety medications. All right. So understand, have I actually exhausted all options, right, for getting to the root cause of this condition or whatever the issues are before I, right, engage in taking a regimen that's going to require my full attention of how I take care of myself. All right. So that's where we leave this at. Okay. Is to I like to say, if you're going to get prescribed any psychotropic medication, understand your condition. Don't just take it for a symptom. Right? Because that symptom could be caused by something external, right, of which your body is responding to. All right? So please understand that just like you get diagnosed on the physical medical conditions, please apply that same concept, that same mindset to your mental stability. Get assessed. Ask those questions. A therapist or a psychologist or a psychiatrist, we ask a different set of questions, right, to help you get to where you need to be in understanding what's going on with your body, but also understanding where did it start. You know, how long have I not been sleeping? How long have I been sad? Did something happen in my life, right, that made this turn that I didn't recognize, and now I've just kind of been navigating life trying to live with, right? Now it has exacerbated itself. We need that starting point. You need to understand the how you got to this place, right? We know sometimes with diabetes, if a person changes their diet, what happens? Medication is reduced and or eliminated, right? So give your mental health the same chance that you would give, right, your physical health if you were on the same type of path to deal with heart disease, right, high blood pressure. We cut out salt. We do this, that, and the other, give up pork, whatever it is that you said, I don't want to take this med, right? I want to change my lifestyle. Apply that to the same, right? Apply that the same way to your mental stability and your emotional stability. Get the level of care that you need. All right? There we go. So we finished this out, right, August. Next week, I'm going to Jamaica. Yes.
Okay. Yeah, we're not doing nothing next week.
We going to Jamaica.
Me and the fam.
It's we?
Is we?
The fam. We are going. It's about time, right? It's about time.
That's nice.
Y'all say
what part of Jamaica y'all going to?
Don't even know. My daughter hooked it up.
Wait, you taking it and just everybody going.
Everybody.
Oh, so y'all going to like it's probably like someplace in.
You gonna say something? You know I don't know.
Okay.
I'll tell you when I come back.
Okay.
Yeah. So we're out of here. Yeah, that was a long time in the making. So there we go.
Deserve it. Have fun.
I know, right?
Yeah.
And be safe.
I know. That's the other thing. Like, we still going. She's like, well, we didn't pay for it. I was like, oh, okay. Good point. Right.
Traveling mercy.
There we go. So we'll be back in September. Right? Kicking it off with talking about childhood disorders.
Oh, that's what we're coming back with, huh? All right.
Find the origins of Dana's problems.
Ooh.
All right.
Okay.
I got a few myself, so I know. Find the Stargate to mine.
Have no childhood disorders.
I'm going to look into adult ADHD and ADD. Right, I'm gonna do my due diligence. That's
but it's very
hot
true.
right now. Yeah, we just stole it from the childhood disorder. We used to say it needed to be diagnosed before a certain age, and now we have said yes. Right, there's a such thing as adult ADHD.
It is.
Well, we'll talk about that.
And it's okay.
All right, y'all. Have a good one. We out of here. Enjoy the rest of your week. Tune in tomorrow for Praise Break Friday. And definitely enjoy your weekend. And I'll see y'all in a couple of weeks. We out.
All right.
It's good for the soul. Oh, I got